Excellent. Well, let's get started. I know people are still joining us. I am so excited. We are kicking off day one of the third annual Joining Our Voices virtual symposium on envisioning the future of serious illness care. I know people are still joining us, but please take a moment to put your name and organization, if you're representing one, in the chat. And feel free, we do like to have very engaging meetings and events. This is one of our largest events, so it'll be really fun to see what happens in the chat line. But please feel free, when you're in the chat line and introducing yourself, to share why you were interested in joining today's session on We Are In This Together, how the caregiving crisis affects us all and what we can do about it. We are curious about what brought you to us today, so we're really excited. I am going to do a little bit of housekeeping and logistics before we get it started. We ask that you do keep your microphones muted, except for our speakers. You get to unmute yours when you speak. For the best viewing, you're seeing lots of boxes. If you haven't already, you want to go and put it in speaker view. We're going to be sure to spotlight the speakers, and that way you can see the different presenters during the different sessions. You can also use chat throughout the session if you have questions. I'm going to be the question chat moderator, and I will keep track of all of them, so that way at the end we can make sure we address your questions. We're going to, speaking of doing my best, I do ask for a little bit of grace and patience. We are so happily overwhelmed with the registration numbers. It has been wonderful. Trish Farnham, you were right. I was wrong. I'm like, I don't think we're going to get hundreds and hundreds of folks. Yes, we have. And so this is going to be a very fun chat line and a very fun event, but I'm going to do my best. But a little bit of patience. This is our first time doing an event this big. We are thrilled you are going to be joining us for what we know will be an engaging and thought-provoking session. This is one of 3 days, so we also want to encourage you to attend tomorrow's session on the future of AI for care and caregiving. Such a shout out and appreciation to our friends at AARP for helping to organize that session. Great overview talk, and then we're going to hear about some new products and platforms and how AI is affecting caregiving. And then on Friday, we are so excited to have a viewing of the short documentary, My Superpower documentary, and a conversation with the film stars, the young Kat and her mom, Krista, as well as other loved ones and staff and representatives from the Children's Tumor Foundation. Both sessions, like today, are from 12 to 1:30 Eastern Time, so we're excited about those sessions as well. As for me, we have lots of new folks. You may not know who I am. I am Heather Altman. I am the Executive Director of the North Carolina Serious Illness Coalition. We are a statewide group here in North Carolina of health professionals, providers, advocates, and caregivers focused on improving the lives of the seriously ill of all ages and their caregivers. We come together and through collective engagement of our active work groups looking at clinical practice and quality, advanced care planning, caregiver and patient engagement, through a variety of communications, advocacy, and education efforts like this symposium. So you are all welcome to join the coalition. We'd love to have you. There is no cost. To learn more about the coalition, you can go to our website. At some point, I'll put it into the chat. That's www.ncsicoalition.org. Or I'm having fun with the chat. Feel free to put in the chat your email and I can add you to our listserv. Many thanks to so many coalition members for developing this symposium over the past few months. As I said, this is our third annual symposium. It keeps growing every year and we are so excited about this. And now I want to turn it over to this session. It hits me in a very personal place. Not only is my professional world all about caregiving and serious illness support and aging support and community support, but I'm also a family caregiver myself. And so I am thrilled to be adding my voice and lots of other voices together. This is the Joining Our Voices Symposium, and I'm absolutely thrilled to be together. And I do want to shout out, this has been a wonderful collaboration, putting this, we are in this together, how the caregiving crisis affects us all and what we can do about it. This session in particular has been a wonderful collaboration between the Essential Jobs, Essential Care initiative of the North Carolina Coalition on Aging, the North Carolina Caregiving Collaborative, which I have the honor of leading with Karen Appert, and of course, the North Carolina Serious Illness Coalition. There were so many organizations and individuals that were part of this planning. It is too many to mention, and I apologize about that, but so much thanks. I do want to give just a moment of extra gratitude to the North Carolina Domestic Workers Alliance for their engagement and helping to arrange speakers, and a huge virtual hug. I see Callie, I know Philip is on here, huge hug to the North Carolina Council on Developmental Disabilities. Not only did they help with organizing and joining as speakers, but they also made it possible the live closed captioning support all 3 days. So helpful. I appreciate that. And with that, I'm excited to recognize my amazing friends and colleagues who are the co-planners of all of this, especially today. Karen Appert, Caregiving Collaborative, who you hear from Liz on in this session. And now, friends and colleagues, both of them for over 10 years. I'm completely inspired by her. We've done a whole highlight about her and her work on the North Carolina Serious Illness Coalition's website. Feel free, she's rolling her eyes. Feel free to look at our insights and Friday facts, so you'll learn all about Trish, but today she's gonna elevate so many other voices. So with that, I'm gonna add a spotlight to Trish and turn it over to you. Hi, Trish Farnham.
Hello, lady, and thank you all. And wow, it is humbling to see an informal idea that several of us had for this session result in the coming together of what will no doubt be at least over 100 people today. Thank you, everybody, for being here. And in particular, thanks to our incredible panelists who you all will hear shortly. As Heather said, my name is Trish Farnham, and I am a staffer at the North Carolina Coalition on Aging. And several years ago, the coalition made a commitment under the leadership of the then director, Heather Burkhart, to supporting the direct care workforce. And in partnership with PHI, which is a national research policy and advocacy organization focused on the direct care workforce, the coalition initiated the Essential Jobs, Essential Care initiative. Since its inception, a collaboration of worker advocates, service providers, long-term care advocates, and individuals with lived experience have come together to bring collective attention to the needs and critical importance of this essential workforce. Meanwhile, the Coalition on Aging and the Serious Illness Coalition were partnering on efforts to affirm the other essential component of the long-term support network, and that is the informal caregiver. As a result, the NC Caregiving Collaborative was born. Led by the fearless Karen Appert, who you all will meet later in the session, the Caregiving Collaborative convenes organizations and individuals engaged in caregiving advocacy with a focus on improving the quality, equity, and accessibility of services and supports for caregivers across the lifespan. So I'm very, very personally grateful, and as a representative of the coalition, extremely grateful for the collaboration that has yet again come together to elevate the important voices that you're going to be hearing today. So thank you. As is the nature of a collaborative work, our collaboration, both within the individual initiatives that I just mentioned and as our work together, revealed and reinforced the unifying, yet often siloed experience of the caregiving crisis. A crisis experienced not just in the aging community, but in the disability community as well. A crisis not just affecting adults, but affecting kiddos. A crisis that is a product of historic devaluation of the caregiving role, a product of the aging of our population, a product of medical advancements, and a product of the demographic shifts. A crisis that will result in this crisis growing worse over the next few years. Data are ever evolving and incomplete, but provide important context for today's conversation. The AARP estimates that there are 1.3 million informal caregivers in North Carolina. And as a sidebar, many would say that's an underestimated number, providing an estimated 1.1 billion hours of care worth, quote, $13 billion. PHI concludes that there are approximately 133,000 direct care workers in North Carolina, making a median hourly wage of $15.52 an hour. OSBM forecasts that the growth in the aging community, that the adult population in North Carolina is expected to double by 2042 and is outpacing the growth of other populations in the workforce. And so regardless of how we examine this crisis, it is a crisis that spans across the disability sectors, across the aging sectors, across the lived experience sectors. And yet within all of those different domains, the unifying denominator to every solution that has been raised and that will continue to be discussed is the caregiver. And no matter how we call those members, whether they're direct support staff, direct care workers, informal caregivers, family caregivers, all of those individual people are the human beings that make up this caregiving community. And anyone who has been a caregiver appreciates that unlike the stock photos that are often found on Google, the care experience is not always neat and pretty. We would rather hear from real people. The caregiving experience is the essence of the human experience. It is raw and real, it's mundane, and it's profound. The support relationship between an individual and their supports may be paid, formal, it may last a few weeks, or it may last a lifetime. And as we all know, the individual experience is both absolutely unique and completely universal. And we are so honored that the folks reflected on this slide, representing family members, direct care professionals, service providers, and people who are sometimes overlooked in the support conversation, the person themselves who use supports. They all have agreed to share their time and their insight with all of us today. Today is both a starting place and an invitation as we work to elevate the shared experience and build a common understanding. Our goal today, hopefully like your all's, is to listen and to learn, and to amplify the lived experience that can and should help shape North Carolina's policy direction. And in an era of siloed and sometimes even divided communities, we hope to elevate the themes that connect us all together. A few housekeeping tips before we dive into our first panel discussion. One of our scheduled panelists, direct support professional Sonia Hall, is recovering from a health emergency and isn't able to join today. So we wish her well and just wanted to acknowledge her contribution to this planning. Second, understandably, Hurricane Helene has dominated discussions across the state this month. And as you can imagine, the aging and disability community and their support networks have been impacted. We will be sharing resources near the end of today's presentation that are working to address that particular experience. And finally, we hope as an audience, you all will participate. And we encourage folks to share your own insights and questions in the chat. As Heather mentioned, she is going to be emceeing the chat line, and we will have opportunities throughout the session to get your input on specific questions and then to share your questions at the end for our panelists. We'll do our best to address all of that by the end of our time together today. So with that, I am really, really honored to initiate our first panel discussion. Several of us will be facilitating panels. I'm honored to facilitate this first one. And I want to introduce, it is my great pleasure to introduce two wonderful women, Carolyn Dowdy and Denise Lugo. Carolyn Dowdy is currently the primary support for her husband, and Denise is a highly experienced direct care professional specializing in home care. I've really enjoyed getting to know Carolyn over the last few weeks, and Denise and I now go way back. So I'm very honored that they've both spent their own time and taken time out of other commitments they may have had to be here to share their insights today. Like all of them, like all panelists, we've asked them to share the parts of their story that they hope others like you all will hear. And then we'll finish with a few questions to both of them. So with that, Carolyn, thank you so much for kicking us off, and the floor is yours.
Thank you so much for having me here today on this panel. Karen, thank you for inviting me. I'm a caregiver, and I started when I was 8 years old. And we are what you call a youth caregiver at that point in my time. These youth caregivers are helping siblings, and they're also helping, disabled parents or our vets or their grandparents. And these children are suffering. The youth caregiver, which I was at 8 years old, I took care of my grandmother. She got hit by a car, and my grandfather and my mother asked me during my summer break if I would care for her, which I did. And so fast forwarding to my 40s, I'm what you would call now is our sandwich generation. And I was working, helping open a bank in Atlanta. My husband was traveling. He was upset at me most of the time because I didn't have much time for him. And then I was taking care of both my parents from a distance, which we call, a distant part-time family caregiver. And my dad had PTSD from the war. He had cancer. He couldn't walk. And my poor mother, who had taken care of a lot of different people during that time, she was ill with diabetes and other things. So she would call me crying. So what you do at that time as a part-time caregiver is you're there emotionally for them, but you feel a lot of guilt that you can't be there to help them. So after they passed away, about 10 years later, my husband and I had retired, and we were on an alpaca farm living the life, and I was happier than I'd ever been. So one night I walked around our bar to get a glass of water. He had come in late from the farm, and he was eating. And I walked back in, and he was screaming and throwing himself out of the chair, and he had a major stroke. That day, our life blew up. So I lost my partner, my friend, my life, and so I had a hard time as a spouse, taking care of someone elderly, taking over that part of his life. And so I didn't have a lot of time to grieve the loss of our relationship. And I was having a difficult time learning everything I needed to do because I was fortunate. We were very fortunate he could walk, but he had a really bad aphasia. So we got through that. We've done very well. He's doing really good now, but he still cannot say a lot of nouns, so he'll always have to be taken care of. But we feel very fortunate. During that time that I had this passion ignited that these poor caregivers that are having to deal with people that cannot walk. And I've had a passion for that for a long time. But the three major things that I'll cover with you that made a real impact on me as a family caregiver was number one is the lack of a cohesive care team communication when you get discharged from the hospital. Because we went home, I didn't realize that if you said 10 o'clock to him with aphasia, he heard whatever, 2 or 3 o'clock. He didn't understand. So it caused a lot of uproar, and he acted out a lot because he didn't understand why I didn't understand. And so it caused a lot of issues with us. And I didn't have a care plan, and I didn't know how to take care of myself emotionally or mentally. I didn't know how to stand myself, and I didn't know what to do. So I just feel very, very strong that we should have discharge programs for these family caregivers. And there's going to be more and more since we have so many aging in our healthcare industry. Because I had read a study that said that if you follow up with these care teams, that it can reduce depression in the family caregivers. So I really wish that we had more focus on that. And then the second thing that I feel very, very strong about is that we should have a formal education program to teach these family caregivers how to sustain and foster their well-being and their self-care. Because if our care, with the volume, with this silver tsunami of 73 million caregivers aging, and then we have over 60% of our kids that have chronic illnesses. If we do not keep these caregivers standing with education, a formal structured program in every nonprofit, in every hospital, we're going to have another sick person, because it's shown that this long-term chronic stress results in illnesses, diseases, and also addictions such as alcohol and drug addiction. And so I feel very strong about that. And it's important because this is going to impact our healthcare claims and everything in our budgets in our states and everything. And then the third thing that I'd like to add is it's important because of the electronic health systems, because my husband has aphasia and he has claustrophobia, and he sleeps in an upright chair because he cannot stand to be laid flat. And every time I go to the hospital, they have it on the record that he has aphasia and that he can't be laid flat, and they lay him flat. So I have to be at every appointment, because he can't drive, but I have to be at every appointment. I have to advocate for him. And so that is very important. They may have the record, but it's very dangerous because of people with aphasia, that if they don't, he may say yes for no because he's hard of hearing also. So there's a lot of legality there about him dying because they didn't understand. So I thank you for having me here today, and thank you for letting me have my voice with you. And I will do anything I can to help anyone. Thank you.
Carolyn, thank you so much for kicking us off and for sharing those really important insights. And I'm honored to transition to Denise. Denise Lugo, welcome. And thank you for, you have the floor.
Okay. Thank you for having me. My name is Denise Lugo. I live in Fayetteville, North Carolina. I'm originally from New York. I am a home health care worker. I'm also a CNA. I started working in rest homes and nursing homes. And when I moved to North Carolina, I went to home health because the nursing home and rest home was like a little bit too much. I've been in there like over 25 years, and it was getting stressful and affecting me and my family. So I came back to North Carolina. I started home health in 2004, and I love it. So it's been 20 years. I have had great clients. I don't call them patients. I have had great clients, great support with the clients, with their family members and things like that. I'm with the National Domestic Workers Alliance, We Dream in Black. I have been with them for about 2 years now. I'm also in a fellowship with them and with We Care. And what we do surveys and of different, try to get help for CNAs and healthcare workers. I'm here today to discuss about 3 different things that's very important to me. One of the things is wages. We do not get paid enough to take care of our family. I've been doing I've been doing home health for 20 years now. This year will make 20 years. And I just received the $15 an hour pay. So I'm glad of that, but I think we need more because we are doing a lot for our patients. We're doing a lot to keep our family structured and fed and trying to keep them going and trying to pay our bills, especially when you're a single parent. So we need that extra pay to keep us going, to keep our family going. Because without us, the family that we take care of, they won't be able to go to work. The family we take care of, they won't be able to go out and get some fresh air for a couple of hours just to go out and get some release, because family caremakers do need release. They have to have that little bit of outside, to just get some air. So, it'll help us and it will help them, for better wage. The training, that's very essential. I don't think home health aides get enough training. Like we have patients that may be paralyzed. The home health agencies don't do enough training to their home health aides. I know a lot because I got my training from the nursing homes and the rest homes that I worked at. So I got a lot of my trainings from there, but I have ran into homes or I have talked to aides that they don't even have half the training that I got. So we need more training for them of how to handle a patient that's paralyzed, how to handle a patient that needs a Hoyer lift, how to transfer a patient from the bed to the chair, from the chair to the bed. You know, we need that extra training, and some of the agencies don't do enough training. So we need that desperately, for not only for us, but also for the client that we take care of, and also for the family, because we can show the family how they can help their family and make it easy on them, on showing them how to take care of their family member, basically, so that they don't have to be stressed out and, you know, all of that. So we have the training, we can give them the training, and it will help tremendously. Healthcare, woo! We have no healthcare insurance. I have worked for a few agencies since 2004, and not one of them gave me healthcare. If we got healthcare, we had to pay it out of our own pocket. It's essential, because if our clients get sick, we can't go to work. If we get sick, we can't go to work. We can't pay for the doctors because we don't always have that copay, or if we don't have insurance at all, we can't. It's kind of hard to find a free clinic. Fortunately, Fayetteville do have a few free clinics, and I thank God for that. But some areas, they don't have free clinics. They don't have clinics where they will help you without insurance. You know, you can't go to a doctor's office and like go in there and think you could be seen without paying something, you know. So I'm very passionate about that, because if we get sick, we can't take care of our family, and we can't go to work. If our clients get sick, we can't go to work because we don't want to get sick. You know, just like the COVID, the COVID is the very best explanation I could say, because everybody was out of work. Half the people, I know most of the people didn't have insurance, and, you know, they did, you know, fortunately they did put out a COVID program that, you know, you can go to the doctor under their program, and that was good. But now it expired. So now what we going to do? So we need health care, we need better wages. And there was one more thing. We travel from client to client. Some clients are out of town and some clients are in town, but my thing is, we don't get mileage for it. We don't get paid mileage. We using up our gas, we using up our cars, we using up, you know, stuff like that, that I feel like we should need help with. But that's my fourth thing. But my main thing is training, wages, and healthcare. If we can get help with them three, the healthcare industry, our agents' family, our agents' clients, our agents' people, and the healthcare agent, the healthcare aides and their family will come out so much better. So I'm looking forward to years to come where everything will work out, and we'll be able to take care of our family, take care of our clients, take care of our agent people with no, you know, better. I'll say better. And that's me. Thank you so much.
Thank you. Those were such clearly articulated points and observations, and I hope everybody has been writing them down just like I was, and underlining them, because they're really, really important. I wanted to quickly, and we only have a minute, but I wanted to ask both of you, Carolyn, if I could start with you. When you hear Denise's observations, was there anything in particular that resonated with you as a family caregiver?
Yes, it's just so important. And she was talking about, I don't think there's enough value put on our paid direct caregivers, of how important they are. Because the thing is, with more and more of us as family caregivers, we depend on them to where we can get time away or getaways where we can sustain ourselves. And it is important. At one point in my career, I understand exactly what she's saying, because I work part-time at a healthcare organization. And I understand when I went in, you know, you have someone that needs to be gotten out of the bed, and that was what I experienced, what she did. is that we might have got a half a day of training. And so it is very important to give the caregivers a break. Like I needed a period of time with my husband when he had sepsis, and I had never been isolated because he could walk, but for 3 weeks he couldn't walk and balance, so I was stuck in the house. And I started thinking, oh my God, these poor family caregivers. And so that Denise and them are invaluable, and they do need all these resources, and we need more of them, and to get more people to come in to the industry to give us help as family caregivers, because I think I've heard or read lately that they're trying now and have programs to try to keep people in the home with them. They've got to have a family caregiver, and then it rolls down to our paid caregivers. And so we need to give them the wages they need and things like that, where they can be there to give us a break because of these 73 million baby boomers. I think the numbers I read is that they'll be 65 or older in 6 years in 2030, and it's called a silver tsunami. So these are things that we've got to start doing for our caregivers now, in which I'm going to need more and more help, from people like Denise, and we need to value them.
Thank you, Carolyn, so much. And Denise, in just maybe a few seconds, can you reflect on what you heard on Carolyn's remarks that resonated with you?
Yes, I understand how she was feeling, about being in the house, and that the training, some of the trainings that we need, and like she said, when you go into the hospital, like they don't listen to you. So we need somebody that can go in there and say, we need more advocates for family members, because some family members, they can't go in the hospital with their family all the time because they got to work. So it need to be somebody there to advocate for them and be like, look, this is on his chart. This is what he needs. Why are you not doing that? So yeah, I really do. I heard quite a few stories about the hospital not listening to the family, or the hospital's not going by what's on the patient's chart. So yes, I really do resonate with that, because I did have an experience with that, not with my family, but with one of my clients' family. She can't go nowhere. She has to be in the hospital with her husband 24/7, because the hospital don't know what to do about his machines. The hospital don't even have his machines. So, it's yeah, they need a lot of training. The hospital needs just as much training as we do.
Denise, thank you again. Just really important remarks. Again, thank you both. This has been incredible, and I really, really appreciate your kicking us off. So, Karen Appert, I'm handing it over to you.
Great. Thank you, Trish. And thank you, Heather, for spotlighting me. As Trish said, and as Heather introduced earlier, I'm Karen Appert, for those who don't know me. I am co-lead of the North Carolina Caregiving Collaborative, and I like to say on any of the caregiving advocacy work I'm doing, most importantly, I was caregiver for a mother who had MS and dementia, and I did that for 25 years. So as Carolyn mentioned, I was one of those younger caregivers, not quite a youth caregiver, but I have an appreciation for a lot of what the stories that happened in the first session. And I'm really excited to moderate this session with my friend Parvati Krishnan and my new friend, Catherine Bunn. So I'm not going to take a lot of time because I'm going to let them introduce themselves. I'm going to ask Parvati to go first, tell a little bit about your story. And just to sort of set the tone for this, we're talking here for everyone on the symposium. This session is specifically about children with medical needs, and the caregivers who take care of them, often which are parents. And I really am excited for Parvati to start this and kick us off, because she has a great way of explaining what a different task it is to be a parent of a child with medical needs. So Parvati, if you'll tell a little bit about your story, and then I'll ask Catherine to do the same, and then we'll have a little bit of a discussion after that. Thanks.
Thank you, Karen, and thank you to the organizers for inviting me. I truly am honored to be here, and I'm so thankful to all of you for even considering and spotlighting pediatrics in this entire session, because most of the times we are considered the orphans in this space. So thank you very much. I do want to start off with that. So thank you very much for that. A little bit about myself. I am a medical mom and a caregiver, and that is very different compared to an informal caregiver, caring for 2 children with complex medical needs involving multiple organ systems. My son was diagnosed at the age of 4 with multiple medical issues, and I have been coordinating his care across various medical facilities nationwide. Today at 16, we continue to navigate his care with limited community support. Our daughter was faced with numerous medical complications from birth and required ongoing care. She passed away at the age of 4 after we transitioned from palliative to hospice care. This journey with both our children turned our home into a mini hospital, demanding a full-time commitment for medical care from both the parents. Unfortunately, we still face significant challenges due to the lack of support and the shortage of pediatric trained nursing care for respite. We are not alone, and we are not a one-off family in our area.
That's closer to that.
Somebody else is,
It's so it looks like that one. That's just a different.
don't mind muting yourself.
Yeah, if everybody
Yeah,
could
and
check
she just
their
got hers, so she just got to a
microphone and make
different
sure they're
place.
muted, please.
Yep. So she just said, and I was on the top.
Trish or Heather, can you see if you can mute? Thank you. Sorry, Parvati.
I'll just say my last sentence, we're not alone, and we are definitely not a one-off family in our area. And I just wanted to give a little bit of more background before I turn it over to Catherine. But a 2021 study identified about 1.5 million children in the US as medically complex. There remains a significant lack of awareness, support, and funding for these children and their caregivers. In North Carolina, although what it may appear as a small percentage of children classified as medically complex, Medicaid expenditures for medically fragile children in 2001 accounted for about $598 million spent on medical services, and that was only for children between the age of 0 and 4. This highlights the substantial financial burden and the emotional toll on families, which can lead to lost wages, poor health, and various direct and indirect costs. The reason I say we're not informal caregivers is because we cannot leave our children and go to work. We have to be there for them 24/7. Doing everything we can at home for them. Children do not have rehab facilities. We do not have nursing homes. We are it for them as parents and medical caregivers. We become all of their therapists. We become their doctors. We become their nurses. We are expected to perform at a very high level, just like medical practitioners would if our children were inpatient. We are the only ones stopping our children or saving our children from going into the hospital. And we try to do everything we can. So I'll turn it over to Catherine to share a little bit more about herself. And thank you for the opportunity.
Hi, thank you so much for allowing me to be here today. My name is Catherine. I bring a unique perspective. I work with providers of home and community-based services through a family of companies providing administrative help and billing help for home care providers, as well as a clinical service who does assessments for home and community-based services, as well as a CNA school that we are working to push the envelope on the training that is available and allowable for caregivers. So that's my professional background, but personally, my son Charlie was born in 2020. He is 4 years old, and he is a fraternal twin. And he is a medically complex kiddo. And I, as well as my husband and our other older children, have been all carried the burden of being his caregiver over the past few years. You know, one of the things that I want to highlight and echo in other panelist discussions is the advocacy role. For Charlie, I knew as his mom the day that he was born. I knew it the moment he was born. The first time I finally got to see him after 24 hours, I knew something was not right with him. And I had to advocate from that moment in the NICU to say something's not right, something's not right. And we started that process, and then everybody assured me that everything was okay. And then 2 years later is when he had his first neurological episode. And then it progressed from there into a medical complexity and into an area of medicine that I never knew existed, even as a nurse. He has a very rare genetic disorder. His genetic variant puts him in a group of diseases that he does not fit the clinical picture for. So the genetic variant in and of itself is rare, and his clinical picture is also rare. And so we have been a part of the Undiagnosed Disease Program, which is an international group of physicians who come together and geneticists to research kiddos like my son Charlie. And throughout his illness, advocacy has been a big thing. And my husband is actually in this meeting right now. He is also listening to the session. I feel like I'll get a giggle out of him when I say this, but I remember vividly the day that he had his first stroke episode when we were hospitalized in an epilepsy monitoring unit, and I had to scream at a room full of physicians and interns and residents for them to listen to me and to do more. And the burden of that advocacy as a caregiver is something that I feel like a lot of times is overlooked, that mental load. And for me, I worked for a long time in behavioral health. I have worked for a long time with caregivers. I am a nurse. I have worked with providers and caregivers, and I've worked in Medicaid. And when it came time for us to start needing those resources, it was impossible to navigate. We actually went through the process last year of trying to apply for Medicaid for Charlie. And the process was so overwhelming and so difficult to navigate, I ended up giving up. And I am somebody who works in Medicaid and is well connected with, various connections in the industry, and I gave up. So I can only imagine what parents and caregivers who don't have that knowledge, I can only imagine the sense of overwhelmed and hopelessness that they feel trying to navigate our system. It was mentioned earlier about siloed systems. That's something else I want to echo. We have a population of direct care workers who go by so many different names throughout the industry. You've got PCAs, you've got direct care workers, you've got direct support professionals, you've got nurse aid ones. And at the end of the day, all of these caregivers come together to provide care. And we talk about the crisis, and when we talk about these siloed systems, everybody has a different title. And so as a caregiver, if I was working for a home care agency that told me I was a personal care assistant and a PCA, and I go to apply for additional jobs because I want to work more, and I'm looking online and I see a job posting for a DSP, a direct support professional, I don't know that I can work as that. I don't know that I can also apply for that. And so you've got these siloed systems where we're all employing the same caregivers. We are all employing the same workforce, but it's so siloed and so different. And the education is so different and not universal, and a lot of times lacking. And so I would like to see us be able to integrate some of these systems and come together to create pathways for education and training and caregivers to be able to recognize the opportunity there, as well as create career ladders for our direct care workers and offer, opportunity for higher education and further education. That's one thing that we highlight as the CNA school that we have. One thing we've been pushing is to be able to offer home care specific training to nurse aid ones in a nurse aid one program. And currently the department's position is that you cannot offer that because it's not a part of the state approved curriculum. And so you see these different, it's like, well, why not? I understand that the original nurse aid one curriculum was meant for skilled nursing facilities, and all of the training modules were catered to that. But the same nurse aid one working in a skilled nursing facility is the same nurse aid one who wants to provide care in a home. And we aren't offering the opportunity for education to be include different healthcare settings. And so those of us who are caring for our client, our kids, our clients, our parents in the home care setting, there's even less opportunity and less well-trained caregivers available that are trained specifically in how to care for somebody in their home than there could be if we just elevated that training. So training is going to be something that I'm sure every panelist today will talk about, and the need for elevated training. And I just want to, echo Denise as well. At the end of the day, we have to get living wages. We have to get living wages for our caregivers. And while I can see the caregiver side of it, I also have the unique perspective of working with the providers and the burden on providers. I promise you that 9 times out of 10, it is not that a provider does not want to pay higher wages. It's the reimbursement rates. It's the unfunded mandates that go into providing home care services. And as a home care agency, that is not allowing us to pay higher wages and offer healthcare benefits, all things that should be a non-negotiable for our caregivers. It should be a non-negotiable. So we need to see support from our legislators. We need to see advocacy. We need to see the changes and the investment into this growing healthcare setting that is going to, over the next few years, become one of the primary settings for healthcare, which is in the client's home. And so we have to see an investment into that to be able to work towards any type of sustainable future for our caregivers and those who need care.
Thank you so much, Catherine. Thank you, Parvati. In the interest of time, just because we have one more session to get through, I'm going to ask both of you to answer a couple questions, hopefully within a minute, and I'm sorry to do that, but the 2 questions that we're asking each panel to answer are what has resonated with you, which I think both of you mentioned that, so you may not have any more to talk about what has resonated with you on any of the stories you've heard so far, but also what would meaningful change look like for you. And again, Catherine, you may have answered some of these, so you may not have any more, but anything else you want to say as a last word before we move on to the next session? Parvati, if you would go first, thanks.
I'm going to echo everything that Catherine and all of the other speakers said. I think one of the most important things that I just wanted to highlight from our personal experience, where we were approved for 40 hours of nursing and 20 hours of nursing aid care. And not once in my daughter's life did she ever receive full support. And we had agency after agency who would come, and just looking at her medical complexities, it was, oh, she's too medically complex for us to find a nurse for her, which I was like, isn't that the whole point? She got nursing care. Then to add on a layer, when she did get nursing care, and then we moved to palliative care and hospice, the nurses didn't want to take care of her anymore because they were not comfortable with her being on hospice care, which then completely negated the whole point of us needing this community support, because we as parents were already going through the trauma and the decision-making of going through all of this complex, structure and something new. We never expected that to happen to our 4-year-old. So I would just like to reiterate that not only is it training, but it's also being aware of the various nuances that are required both in pediatric care and adult care. Our children sometimes can also be fully load bearing and needing to be lifted and fully dependent for change. And those are not things that nurses are aware of or being trained for, which is very different when you have a rare disease. They also don't get paid. And it's really disheartening because, we as parents, we have told them, like, we will give you supplemental income, just stay with us. It's been very heartbreaking because they then, of course they don't get paid for miles or mileage. And, as families, we understand that. But at the same time, if they didn't come to us, we cannot even go to work and maintain the insurance we need for our children. The last thing I want to say is some of the things that are unique to the pediatric population. If our child is being cared for by a nurse or a CNA and they have to be going to the emergency room, the nurse or the CNA cannot sit with them in the ambulance and go. So those laws need to be changed. We as parents are trusting them to take care of them in our house, yet they are not allowed to ride. So my 2-year-old at that point went in an ambulance by herself, and the nurse had to follow her in a car. So these are very unique differences that are not usually thought about. So when you're writing policies, you're writing legislation, and you're training all of these people, these are some things to think about in training curriculum. curriculums, in laws and in policies, because these are so important to families. You don't want your child traveling alone in an ambulance with strangers they don't know about. You want them to be with a safe nurse or a family member. So I think from a broader perspective, I think salary and quality of life better for nurses and CNAs will help parents and caregivers alleviate some of the problems, and then better training so they can be comfortable and caregivers can be comfortable bi-directionally leaving them in their care.
Thank you so much. And again, I think a lot of these, I thought it was great that you mentioned that a lot of these cross over, whether you're caring for a younger person or an older person, but that some are very specific to the pediatric community. Catherine, last word. If you can do it in about a minute, we'd appreciate it.
Yeah. The only last thing I want to highlight is the need for, and I think this was mentioned earlier, the need for more resources for the family caregivers. Mental health is something, like I said, I worked mental health for 6 years of my career, and navigating my own mental health as a caregiver has been incredibly challenging, and accessing therapy and, at an affordable cost, and therapists that actually understand what we're going through. I hate to say this, but a standard therapist oftentimes does not have the skill set to appropriately work with moms. I think of medically fragile kids. I don't know about other age groups, but I have found that it has been very difficult to find a therapist who can help me navigate the traumas of being a medical mom. So I think mental health needs to be considered, and resources for that need to be in there as well. And for the caregivers, the paid caregivers providing care to, our families, they also need mental health support because they're bearing some of the burden as well.
Thank you both so much. I really appreciate you coming on and telling your stories and sharing what is really important, both your stories and your ideas for solutions, which I think we'd all agree with. And I'm looking forward to more conversation later in this symposium with questions and answers. In the meantime, I would like to move on to introduce Tally Wells, who is Executive Director of the North Carolina Council on Developmental Disabilities. And he will be starting the next session and next panel discussion by showing a short video. So Tally, I'm going to turn it over to you.
Thanks so much, Karen. And I just want to say how grateful I am for this panel and for your leadership, for Heather's leadership, for Trish's. The Essential Jobs, Essential Care, EJEC, which has been mentioned here, has been a phenomenal group of advocates across the different systems that need paid caregivers. And it's just been such an important part of the advocacy effort that's happening in our state. And I want to start out by introducing myself and talking just very briefly about some of that advocacy, and then we'll have a short film, and then please stick around for Ashley Large. She is extraordinary, and she'll be who I'll be interviewing after the film. The North Carolina Council on Developmental Disabilities is a governor-appointed council, and we have 40 council members. Majority of us are individuals with developmental disabilities and family members, and our work is advocating for the intellectual and developmental disability community to live full and meaningful lives in the community. And we are in crisis, just like you've heard throughout this meeting today. We have two main crises, a waiting list of over 17,900 people waiting for developmental disability Medicaid services, and we have a workforce shortage. We made some progress on the waiting list with a new Medicaid service that is in the process of rolling out called 1959, but we continue to have the workforce shortage. And so we've been doing a lot of different things on that. We have a Meet the Need initiative that is focused on that. And Beth Field is here. She could put a little bit about that in the chat. We've done a rate study to look at how much we were paying people pre-COVID for direct support professionals, and that was about $11.50 an hour. that has gone up to around $15 an hour, but we still have a huge workforce shortage and a need to get rates up much higher as we do for direct support professionals across all of the categories. We've done an economic impact study with the University of North Carolina, Greensboro, and the ARC of North Carolina. John Nash, who was the executive director of the ARC of North Carolina, is here and was a real driving force of that in that economic impact study. And I know it's the same for all of the other direct support professionals we've talked about here. A paid direct support professional, when you pay a developmental disability direct support professional, that is about for every dollar you pay that direct support professional through Medicaid, an additional $1.17 to $1.63 of additional dollars are churned out in that community. And so John has a great example of that. $2 bills, if we paid direct support professionals in $2 bills, you would see them popping up over and over again in those local areas because, we just don't pay people enough, but also because people, direct support professionals tend to stay and shop and do everything else within their local communities. We've done a film and we're about to see a clip from that. Luke is the person who's in the film. Luke lives in the mountains. We do know that Luke and his family did make it through Hurricane Helene, but they are now experiencing not only the direct care workforce crisis, but also what it means to be experiencing Hurricane Helene right now. So think about that. And then the last thing I want to say is that there's an election going on. I think most people know that. And now is the time to be talking to your candidates. So if you haven't talked to your candidate yet, if they don't know your caregiver story, if they don't know about the needs for direct support professionals, you've still got a whole 6 days left to reach out to them. So do it today or do it tomorrow. You have two choices, today or tomorrow. Find out who your candidates are. You can go to the Secretary of State's website, but find out who your candidates are. Make sure, particularly your state level candidates, know about what's going on. Tell them your stories. So with that, we'll show the film. I do want to say I'm really excited that Ashley is going to be here because this film is really important. A lot of it is told through Luke's dad's perspective, and we have our council is split between family members and individuals with developmental disabilities. And I think it's important to hear both perspectives. Sometimes they're not always exactly the same. And so we'll hear Luke's and his dad's story, and then we'll hear from Ashley Large. So I'm going to try to share my screen and share the video.
Hey, I'm Luke. I'm a spastic quadriplegic with cerebral palsy. I'm using my computer to help me communicate by using eye gaze because I can't speak on my own, so the computer becomes my voice. I live with my elderly parents in a small cabin in the woods, and they're my caregivers. I use live support staff, but it's become harder to find people who want this job. I'm worried about myself and my parents because they won't be able to care for me forever. Everything is falling apart because nobody wants to work with me. It's just my parents and me.
Our main concern is worrying about Luke and who's going to take care of him when we're gone. Now, we have had several caregivers here that's helped us through the years, but right now, after the pandemic, it has gone to nothing. Who is going to take care of Luke after that? Because there's no one else here that really knows Luke that well and what to do and how he talks. Some people can understand he spells words out for you. And when he's just laying in the bed, he'll spell words to tell you what he's wanting. He needs help with everything, from the time he gets up in the morning, getting him out of bed, feeding him breakfast, going to the bathrooms, everything. He needs total 7/24 care. Fixing his meals, cleaning everything for him. The caregivers, they've done a good job. But like I say, since the pandemic, nobody's putting in applications for the jobs anymore, hardly. They're getting in a few, but not much. And it's not like it was before the pandemic. Where does Luke go when we're gone? When we're not here anymore? Who's going to take care of him? And that has been my big concern for 25 years. What we're scared of is he's going to end up in a nursing home because he's total care. And none of these other private places take total care. He's just something else in education. He can spell anything. They say with this computer that probably one job he could get would be teaching people how to operate the Toby, because he is so efficient in it. They say he's probably the best they've ever seen. I'd hate to see his life just not matter to anybody.
So we've got a lot of work to do, and I'm just grateful for each of you who are here, and super grateful, Ashley, for you to be able to share a little bit about your story. And I want to introduce you and then got some questions for you. We're just going to have to work together on all of this because we've got a long way to go. Ashley Large is a rehabilitation counselor who has worked for the Alliance of Disability Advocates, a center for independent living, since 2019. During that time, she worked with North Carolina's Transition to Community Living program, helping people with a mental health diagnosis move out of adult care homes and live in the community. Ashley is now the regional director of the Alliance of Disability Advocates' second office in Greenville, North Carolina. She serves as the vice chair of the statewide Independent Living Council. Ashley has quadriplegic cerebral palsy, and she uses personal care assistants to assist her in daily life. She lives with her husband and 2 dogs. So Ashley, I just want to start out by making sure folks know what a Center for Independent Living is. So if you could just tell us just quickly about your work and what a Center for Independent Living is.
Absolutely. I'm glad to be here, first of all. A Center for Independent Living is a nonprofit organization that empowers people with disabilities to reach their goals, either through removing barriers or teaching people the skills and adaptations they need to be successful in their goals. Centers for Independent Living are federally mandated to have over 50% of staff identify as someone with a disability. This helps our staff to connect with the people we serve. The services such as peer counseling, advocacy, IL skills training, etc.
Oh, yeah. Yeah. Just yeah. They could choose services.
Those skills are all consumer led, meaning the consumer chooses how and what services are provided.
For example, it's our
For example, if someone wants to learn how to write a resume, then that means that we help teach them how to write a resume. But if someone wants to go to a comic convention, then we help them access buying tickets.
To get to
and help them learn how to get to the event.
So Ashley, how do direct support professionals enable people to live independently?
I want equal pay for today.
Direct support professionals help people with disabilities to basically have an equal playing field to their life.
About how they want
About how they want to see their life be.
They can look at how folks around us and even when to choose to or individual money.
They can assist with personal care, housework, reminders, even behavioral management cues, depending on what each individual needs. And this alleviates challenges from the disability itself.
So let's get personal. So you've been kind enough to offer to share a little bit about your own life. Why do you need a direct support professional? What do they do for you?
Okay. I think I heard someone say this earlier, but
I think I heard someone say this earlier, but I use the term personal care assistant.
So I have used for 20 years.
I have used personal assistants for 20 years.
No. I refer to them as
I refer to them as my hands.
but are they every task requires that scary.
Because they help me with every task that requires dexterity.
That includes not only personal care, such as getting dressed, doing my makeup.
This includes not only personal care such as eating, showering, getting dressed, putting on makeup,
But also cooking on the even going to
but also cleaning a house, cooking, running errands, and going and even going to work.
I joined my personal care we speech and interpreter to pursue fast and acceptable communication.
I also trained my personal care assistants to be a speech interpreter to facilitate fast and accessible communication.
I can appreciate you to all that language and every single thing even that.
I take PCAs with me to work, doctor's appointments, and even when I was single, on dates.
Awesome. So you really wanted to make sure to talk about self-directed care. What is it and why was it so important to you to bring it up today?
I know
I absolutely. I
never question time.
I know we're close to time. So for the last half of this answer, my interpreter will take over and just read what I have prepared. Often self-directed care is a term that is used with Medicaid, but also with Centers for Independent Living. To describe the person helping who help
promote the use of
to help promote the use of personal care assistance. So this is like when anyone with a disability who's receiving the actual care being in control of who they hire, how and when support is provided,
and
in some places the person is actually the employer of record. This is compared to someone who's using an agency for personal care services. Such as home health or any agency like that. I have always used self-direction, and it has prepared for me for the independent living philosophy
it's important
that we use at a Center for Independent Living.
it is crucial
It is crucial for me to be making the decisions of who and when I have helping me with very intimate tasks. My first year of college, I used a home healthcare agency in the mornings. Even though I requested them to come at 8 a.m., there were Sunday mornings when they would show up at 5:30 a.m. As a freshman in college, I more than likely had gone to bed 2 hours before. I even learned that same year how crucial self-direction image was to receiving adequate care and how I was treated. When I got to college, my parents attended the first interviews and trainings I had with my first personal care assistants. There were instances for weeks following where my PCAs would refuse to assist me with tasks I needed. My parents loved to tell the story that when they came back to visit for fall break, I had fired everyone and hired and trained all new staff. Medicaid is the only health insurance that covers personal care assistance on a consistent basis. In recent years, North Carolina has adopted the Medicaid buy-in option. This helps North Carolinians with disability to work and keep their Medicaid or personal care assistant coverage. However, the buy-in in North Carolina is capped at $24,000 a year. I am in a unique position where I make too much to qualify for the buy-in, meaning I pay out of pocket for PCAs. Other states like Texas have a $5,000 per month cap or $60,000 a year. And California got rid of any wage restriction altogether. Having a disability still comes with additional expenses, no matter how much money you make. As
So,
one of the
I'm sorry, Ashley, we've run out of time, but we have one last question that you've got to answer for us because you're the main disabled panelist.
Yeah.
What do folks need to understand from your perspective as a person with a disability about caregiving?
By choosing to go into caregiving, you are enabling someone to live their life. Whether or not they do use self-direction, you are in someone's life and home. When I train a new personal care assistant, I emphasize language. For example, someone is helping me eat. They're not feeding me. Because this is how I eat. My PCAs also help me cook. They might not know which weird vegetarian meal I'm making that night. Nor would I expect them to. This kind of outlook is very powerful to the person receiving assistance. Even having self-direction myself. It's not about having control or minimizing how crucial or minimizing how crucial the work caregivers provide.
Giving people the same autonomy
It's giving people the same autonomy and dignity and dignity that any able-bodied person has.
Thank you so much, Ashley. And I know you also wanted to share about your experience with COVID, which was awful, and you couldn't find folks during that time. And it really makes me worried about the hurricane, but we've run out of time. So if you want, you can share those comments in the chat. Thank you so much, Ashley. And I will turn it back over to our leadership to take us to the next step. But thank you, Ashley.
Ashley, thank you for sharing your insights and honestly being literally the heartbeat of so many of these dynamics and these crises that we're working to come together to address. Just for the name of time, we're going to streamline a few of our slides coming up, but we did want to make sure, excuse me. There I go. Woo. We're really looking to synthesize what we heard today from all of our panelists and appreciate your all's help. If you all see unifying themes that you want to share in the chat, we would really appreciate your wisdom and your insight on what you've heard and some of the unifying themes among all of the panelists or certain segments of the panel. So thank you so much for adding those to the chat. We're going to organize those. And again, those will guide our work just like everything else that we've talked about today will. Just as speaking of guiding our work, we wanted to make sure that people were a bit oriented to some of the landscape work that is happening in this space. So we're not going to go through each of them in detail because each of them could be their own webinar, but we wanted to make sure that everybody at least was informed on some of the seminal work that's out there that really is examining this important critical relationship and interconnection between direct care workers and family caregivers. And as we work to address this caregiving crisis. So many folks may be familiar with the Administration for Community Living's initiative to develop the national strategy to support family caregivers. The goals are highlighted here. Karen Appert is our resident expert, and she is an expert. So if you have questions, you'll be getting her information at the end. So we encourage you to take a look at this if you aren't already familiar with it. Equally important is the work that the National Alliance on Caregiving and PHI are launched earlier this year in the summer that really examines the exact dynamics that we're talking about today. In fact, we were all working in tandem with each other. We have identified their key recommendations here on the slide. You'll see some things that probably resonate with folks, what folks said on the call today. So we want to make sure to highlight this document as well. There's also a presentation available at the website provided if you're interested in seeing it. Closer to home on the state level, our Department of Health and Human Services and our Department of Commerce came together earlier this year to really examine the crisis of the direct care workforce and the quote healthcare workforce, and released this strategy earlier this year. Proud to say that many people on this call actually helped form and advise on those recommendations, and those are being used to help guide any future conversations we have in this space. As is, and many people on this call were connected to this effort, the All Ages, All Stages, a Roadmap for Aging and Living, the multi-sector aging plan that was authorized by executive order and recently released. And it is, again, a seminal document that really does provide a comprehensive strategy for how we address aging in North Carolina, and certainly with key dimensions of the direct care workforce crisis and the family caregiving dynamic integrated into that. So we just wanted to make sure you were aware of those documents, again, because we have such a cross-disciplining group coming together today. We just want to make sure folks are aware of it. If you have others, because we know that this is an incomplete list as we collect resources, we want you to help inform that list. Please, again, use that chat to recommend other seminal documents or initiatives that really have guided your thinking or that you think are really important to make sure remain on our collective radar screen. So thank you. Just to give you a quick overview of where things are starting to emerge as our shared focus. As you all, we mentioned in the beginning, these initiatives have been separate and independent for a couple of years now, but we're all really good friends, and we also recognize the inherent interconnection between the two groups. So on this slide, you have some of the areas that have been standing items of the EJEC's priority list, really focusing a lot on the Medicaid service delivery space to make sure that long-term services and supports respect and acknowledge the essential role that direct care workers play, that rates accommodate both direct care worker living wages and the administrative needs of organizations, and also are flexible to advance the self-directed options that Ashley mentioned earlier. The couple of things in yellow are things that we know have been added to our list based on these conversations. And so we're really honored and appreciative of the insights that people shared today that really helped expand and inform this expanded list. Last thing, and I know we're getting very close, but want to leave a couple of opportunities for questions. Because Hurricane Helene had such a catastrophic impact in North Carolina, there are just an enormous amount of resources out there, but we wanted to make sure to elevate and bring particular attention to some of the resources that are available for supporting families, individuals, older adults and people with disabilities, family caregivers, direct care workers, and then some of the departmental flexibilities and policies that have been issued to be responsive to the needs of Hurricane Helene survivors. So just wanted to put these particular resources on the page. We know you have lots and lots of resources out there about Hurricane Helene response, but these may be particularly relevant to our conversation today, and we just wanted to highlight them. Finally, I think we have a couple of opportunities for questions. We are going to end on time. So Heather Burkhart or Heather Altman, if you can MC us a little bit to see if there's any particular questions you want to elevate.
Always honored to hear Heather Burkhart's name too. Hey, Heather, the other Heather A and B are both on. So we had a lot of support throughout the session on the chat line. It was great. Just so much respect and honoring and gratitude for all of our panelists sharing such personal and honest observations and some great ideas about how to advocate and the types of things to advocate for. 3 specific questions that came out in question form. There was a question about what is the process for getting an increase in the hourly wage for home caregivers? So not sure. I know from my
this is Tally. I can just say really quickly, it depends. If it's coming out of your pocket, then it's coming out of your pocket. But if if you have Medicaid or some sort of government support, the main place is the state legislature, the General Assembly.
Mm-hmm. Thank you. I'll go on quickly because I know we have a minute left with Trish. Did you want to say something?
Yeah.
Okay. So other question, and I know this is a much bigger issue, but it's, I think, an issue we're going to tackle because it's part of a unifying theme. What are the group's thoughts on Medicare as opposed to just Medicaid covering some of these home and community-based services? We do have one of our presidential candidates actually talking about this and making a key component. So I am thrilled that that is in the national conversation now. So I don't know if there's another answer to that in the next 10 seconds, but I feel like this group is generally very supportive of having a bigger role for Medicare in home and community-based services. Trish, do you want to add anything?
Just the wheels are turning in various Medicare Advantage plans. The wheels are turning slowly and they are very much in their infancy stages. I also want to give a flag to the VA, the Veterans Administration. The Veterans Administration is actually doing a lot of really important leadership work in the direct care support space. And so it's something else to pay attention to as well. Okay.
Yeah.
Okay, there was another.
This is Merced. I would also share along with what Trish said, that in the Medicare and Medicaid space, the Centers for Medicaid Innovations, they're doing a lot with these care models that will incorporate things like this in terms of home supports, et cetera. So looking at what those models are going to do as well. And so we definitely have some advocates on the Hill working on those pieces.
Fantastic. Marissa, thank you. Just rushing along, and there's two more questions. Do you have a ballpark estimate on how many family members are providing support versus non-family direct care workers? I'll take, unless Karen, in terms of family members, we are hearing, and the family caregivers, we're hearing as low as 53 million and as high as way over 100 million. Karen, did you have other numbers that you want to add?
Yeah, I was just going to say, and in North Carolina right now, our estimate is 1.3 million, but we all feel that that's low. Trish mentioned that earlier, and I think that's part of the initiative that the national, one of the initiatives that the goal, one of the goals of the national strategy is proposing, and that is to get a more consistent data sourcing so that we can have those more accurate numbers, not just nationally, but at the state level.
Mm-hmm. Trish, can you speak to, I don't have it off the top of my hand, the non-family, so direct care workers, how many do we have in the US, and do you know in North Carolina? Putting you on the spot.
In North Carolina, we have about 133,000 direct care workers.
Okay, great. There was a quick question, and I don't know the answer. I have a quick about how will Medicare changes impact pediatrics? I don't know if they do. I look at more Medicaid being more involved with pediatrics. Tally or Trish, do you have a thought about that?
Can I make one quick point? Because I say this to Parvati all the time. What I like to think of is that we push, those of us advocating on the older adult side, push for changes to Medicare that hopefully we can then advocate on the pediatric side for other places to have similar innovations happen.
Mm-hmm. So I'm going to hand it over, because I know we're 3 minutes late, for Trish to do a last slide on who we are, or do you want me to do it?
Just a very quick thanks to all of our panelists. We wanted to make sure everybody had the resource links for all the organizing partners today. And you also have our email addresses, the folks who have been hosting today. Our intention and our goal is to organize our thoughts after this incredible learning opportunity and be back in touch. So thank you for signing up for this. We hope it was a good use of your time. I have to suspect it probably was. And really, really appreciate your staying with us. With that, I think we're going to say thank you. Have a wonderful afternoon and enjoy the rest of the symposium. Thanks so much, you all.
Thank you, ladies.
Thank you. I did put an evaluation link in there. You can put it for this session and then for other sessions. And we really hope the next 2 days, hopefully equally engaging and wonderful, totally different. Tomorrow will be on the future of AI for care and caregiving. AARP friends, thank you so much for arranging that. And then Friday is the My Superpower documentary and panel discussion. So hope to see you all then. And really thank you so much to the organizers and to the speakers and to all of you for joining us.